What's up, friends? Welcome back to KimmyDTV, a place where nurses and aspiring nurses come to achieve academic and career success. For those of you guys who may not know, my name is Kimmy D, and I have been an LPN for 7 years, and RN at the end of May will make me 6 months as an RN. I know time goes by super duper fast. And I basically make videos on this channel to inspire, to educate, to support, and to share my experiences within nursing and thereby making your nursing journey easier. Okay, just making your life easier in that way because, you know, in the beginning of my career, I didn't have a lot of help, and I basically had to feel through the dark and figure things out on my own. And there was not a lot of help for me. So that is why I made my channel to help people in that way. Well, that's why I started making videos on nursing for that. Okay. So I see 3 people already watching. So if you guys please can help me out by hitting the like button. And today we're going to be going over the endocrine system. I just started these little study sessions where we go over certain questions we're breaking it down from different body systems. So you guys can hit the like button. Don't forget to subscribe and hit the notification bell so that you never miss a video from me, okay? So I'm going to wait until a little bit more people come in before I start. Last week was pretty good. I hope your week has been very well. I hope you guys all enjoyed your week. Yes. So I don't want to take too long. So if you guys are ready, type ready in the comment box. Okay. All right. So I think I waited a little bit enough, and I'm going to start, okay? So we are going to be going over the endocrine. Let me just share my screen. Share. It's kind of hot in here. Let me open the fan. Okay. Share screen. Okay. Hey, Brandy. Nice to see you again. Brandy is ready. Yay. Thank you, guys. Don't forget to hit the like button. I'm so happy to see you guys here. Yeah, the more people I see that like these kind of videos, I'll continue to make them. All right, so let's start. I always forget how to do this as like a slideshow. Okay, there you go. Slideshow. Duh, Kimberly, duh. Okay, so, all right, so welcome to endocrine and neuro questions. If you see me looking down, I just have my phone here so I could see your questions so I don't have to keep like exiting, okay? So endocrine and neuro questions, MedSurg live review for KimmyDTV. And remember, questions are welcomed here. There's no such thing as a stupid question. I know how it feels like. I've asked many questions before in nursing school, and people will be upset, roll their eyes saying, you still don't get that? And I know how that feels. So there's no such thing as a stupid question here. I don't care how stupid you think it is. Ask it, and I'm more than happy to help you guys, okay? All right. All right, so we're starting off with the first question, okay? So the first question says, a patient is diagnosed with thyroid storm, okay? So which of the following assessment findings would the nurse observe in this patient, okay? So I'm going to let you guys kind of give your answer in the comments, and then we'll go over that. But initially, when I see these questions, I say, yay, they finally tell us what the patient has. So usually a lot of the questions will come with symptoms, and it's your job to figure out what's going on in the patient and tell them. Okay, but this question is in reverse. They're telling you this patient has this, they're diagnosed with this. What would you see in a patient who has a thyroid storm? Okay, so the first thing you have to know a little bit of anatomy and physiology. That's why I always say, before you start nursing school, I said this before and I will say this again, because repetition is the only way someone remembers, is that before you start nursing school, when you're taking your anatomy and physiology prereqs, it's so important that you take anatomy and physiology seriously and you really get it down. Okay. All right. So Brandy Jones says C, increased body temperature, increased pulse, and increased blood pressure. Okay. Anyone else? As you guys come in, please hit the like button. It lets me know that you guys like these videos, and it really, really helps my channel. Okay. So Brandy Jones says C. Does anyone else have any other answers? Okay, let's see if Brandy is right. Let me put her answer on here. So Brandy Jones says C. Okay. All right. This is the answer. C, you are correct. So basically, a patient who is diagnosed with thyroid storm, they will indeed have increased body temperature, increased pulse, and increased blood pressure. But why? Okay. So I start off with, you have to first understand the anatomy and physiology of your thyroid. So the thyroid is a gland right in front of your neck, okay? And the thyroid actually produces two hormones, T3 and T4. And the main job of your thyroid is metabolism and growth and development. So basically, when you think of the thyroid, think of your metabolism, okay? And your metabolism is, to put it in the simplest terms, is how your cells work efficiently. Meaning, it's like when someone says, oh, you have a high metabolism, you could eat whatever you want. You ever hear that? That means when somebody eats food, their body processes it, it digests it really quickly, and it's already expelled into the bowels as stool. Okay, so that means your body is working very fast. Okay, that's basically what it means when somebody has a high metabolism. So that's why they could be very thin. Versus if somebody has a slow metabolism, it may take time for their body to digest the food, so they may be more overweight because their metabolism is slowed down, right? So I put here the thyroid is producing too much thyroid hormone. So the thyroid produces T3 and T4 hormones, and those hormones basically controls the rate at which every cell works. Okay, so if you think about it like this, the cells in your body basically make up who you are. And it's responsible for controlling your blood pressure, your pulse, everything, because cells are basically what we're made out of, right? So this condition is actually life-threatening, okay? So anytime when you see someone has a thyroid storm, think that everything is going to go up, okay? Everything, and I put in quotation marks here, vitals, everything goes up, so it must be treated, okay? So anytime a patient goes through a thyroid storm, everything is going up. Increased body temperature, increased pulse, increased blood pressure, because the body is going out of control. It's like, think of like a storm, okay? It's right there in the it's like right there in the increase in the keyword, okay? So it's not going to be increased body temperature but decreased pulse and decreased blood pressure. It's not going to be increased body temperature, increased pulse but decreased blood pressure. No. When a patient has a thyroid storm, everything goes up. Because remember, the thyroid has to do with metabolism, okay, and how every cell in your body works, those hormones, okay? That's what it works. So I hope you guys understand that, and let's move on to the next question. Okay, the next question says, a female patient with a history of chronic hyperparathyroidism admits that she has not been compliant with her medication. Based on your assessment, you come up with the nursing diagnosis of risk for injury. To complete the nursing diagnosis statement for the patient, which related to phrase should the nurse add? So would you add A, risk for injury related to exhaustion, secondary to an accelerated metabolic rate? Would you choose risk for injury related to edema and dry skin, secondary to fluid infiltration into the interstitial spaces? Risk for injury related to tetany, secondary to a decreased serum calcium levels? Or risk for injury related to bone demineralization resulting in pathological fractures? So essentially, this question is asking you, if someone has hyperparathyroidism, out of these options, out of these answers, which one will they exhibit? Which one will they have? That's essentially what they're asking you. So I'm going to let you guys write an answer of what you think it may be. Oh, my contacts are kind of dry. But yeah. So you have to ask yourself, what would a patient with hyperthyroidism exhibit? Like, how would you know a patient with hyperthyroidism who didn't take their medication? Okay, so we have an overactive parathyroidism, The parathyroidism is acting too much. So what would you see? Because the patient is not taking their medication, so it's not being controlled. Okay, Brandy Jones Wilson says C, maybe. Okay. And remember, in order to answer this question, an overactive parathyroidism, we have to know what is the normal function of the parathyroid in the first place. Okay, so let's see. Or A. Okay. All right. Let's see the answer. The answer is actually D, hyperparathyroidism. That patient would have a nursing diagnosis of risk for injury related to bone demineralization resulting in pathological fractures. Let's see why the answer would be that and not A or C. Okay, so basically your parathyroid glands, okay, so you have your thyroid, right? And as you guys may see from this picture, you have your thyroid, which is in the pink, and the 4 small blue, they kind of look like peanuts on the thyroid, are actually your parathyroid. So now remember, we said in the last question that your thyroid secretes T3 and T4, which have to do with metabolism and how your cells work, right? So I understand why you would choose A, exhaustion secondary to an accelerated metabolic rate, but this would be it if it was hyperthyroidism, right? This would be the case if it was hyperthyroidism, because thyroid has to do with the metabolism, but we're talking about the parathyroidism, okay? So the parathyroids are the four small, like peanut-looking shape things here on the thyroid, and their job is to keep blood calcium levels stable, okay? That is their main job, okay? So hyperparathyroidism is when there's too much parathyroid, okay? So I put here in the slide is the parathyroids control the amount of calcium in your blood and calcium in your bones, okay? So it basically balances it, okay? So we have to know what is a function of calcium, okay? So we need calcium for so many things. Yes, we do need calcium to maintain strong bones, but we also need calcium for other regulations in our body, like nerve conduction and stuff. So that is why it's important. So I put parathyroid controls the amount. So the parathyroid's main goal is to control the amount of calcium in your blood and the amount of calcium in your bones. So we need calcium in our blood to help our heart act right, to help with the contractility of the heart, to help our nerves act right. So if you go back to AMP, especially AMP1, you will see the role of calcium in nerve conduction and heart cardiac contractility. Like calcium is a major element in the body. And then secondary to that, it helps with the bones, right? So we need calcium in our blood and we need it in our bones. We need like a balance of both, right? So if there is too much parathyroid hormone, then there's not enough calcium being deposited into the bones, which will make the bones become very fragile, right? So even if you Google what is the function of calcium in the body, and that's when like some people can get a little confused. People say that, oh yes, we do need it for strong bones, but it's also an important mineral in our body, okay? So you could just Google here. It's good at clotting blood, sending and receiving nerve signals, squeezing and relaxing muscles, and keeping a normal heartbeat. So essentially, even though you may see a lot of commercials saying, yeah, calcium is with strong bones, everybody knows calcium helps with bones, but a lot of people don't know the first main goal of calcium is actually to helps with sending and receiving nerve signals. And you know, the nervous system is so important in talking and walking and moving. So calcium is super duper important in that. And calcium is super duper important and in muscle contractility, moving your muscles. So calcium is that mineral in your body that you really, really need, okay? So, you know, our heart is a pump, is a muscle. We need it to survive, right? Because it's always pumping 24/7 for us. Calcium helps with that pumping action of the heart. So that's why calcium is super duper important to have it in the blood. But we also need it in the bones, of course, so that we could stay strong and that it doesn't break. So if there is too much, so that's what the parathyroids basically do. The parathyroids regulate the amount of calcium that you're going to see in the blood and the amount of calcium that you're going to see in the bones, okay? So too much calcium, which is hyperparathyroidism, removes a lot of that calcium from the bones into the blood. So this can cause pathological fractures, okay? So that's why it's D, actually. That's why it's D, related to bone demineralization resulting in pathological fractures, okay? So why is it not edema and dry skin secondary to fluid infiltration into the interstitial spaces? No, edema and infiltration, that is related to hypothyroidism. And we'll get into that later. And another word for it is like myxedema. So hypothyroidism is when, you know, that thyroid, again, like I said, is that pink picture that you see here. Hypothyroidism is when the thyroid does not produce a lot of T3 and T4. So that will cause edema and filtration because the body is not moving things fast enough, okay? So they have a slowed down metabolism. So, fluid is not being filtered out as well. So that's why the patient will blow up, right? So that has nothing to do with that, okay? And tetany, secondary to a decreased serum calcium level, which is C, it will not be that, because by default, hyperparathyroidism, that's too much calcium in the blood. Too much calcium in the blood. So you wouldn't see tetany. Tetany is related to low calcium levels in the blood. So you would not see that, okay? So I hope this makes sense of why the other answers aren't correct. Does anybody have any question related to this question? Because I know this one was kind of tricky. Okay, so yeah, so the reason why I go over all the other answers to see why the others aren't right is because we want to know why they aren't right. Because if you have another question and one of these answers, the content of these answers might be right, I want you guys to understand why it's not right or why it's wrong. Because if you understand why it's right and why it's wrong, you'll always get this question right, and you'll understand. Okay, so if it's not tetany, secondary degrees, it's not tetany. Why is it not tetany? Okay, Brandy says it makes sense. Good. All right. Next question. All right. So the next question states, you are the nurse working on the med-surg unit, and you have a patient who is currently taking levothyroxine 23 mcg PO daily. Okay, which finding should the nurse recognize as an adverse effect? Okay, I'm going to let you guys pick the answer first. But remember, if you see a medication up there, you have to ask yourself, okay, why would anyone, be taking levothyroxine? Why would the doctor prescribe a patient levothyroxine? And what would be an adverse side effect to that medication? Okay, and keep in mind, when you're being asked a question about a drug, you don't necessarily have to not always, you don't necessarily have to memorize a list of adverse effects. If you know what the disease is and what the disease treats, this is a little clue here. If you know what the disease is and what's the treatment for the disease, what would be too much of that treatment? What would happen? It would be the opposite of what you want, right? So I'm going to let you answer and see what you guys think. Don't forget to hit the like button and subscribe, hit the notification bell so that you never miss a video. Okay, what would be an adverse effect of levothyroxine 23 mcg by mouth daily? What would be an adverse effect? To help you out a bit, levothyroxine or Synthroid. Okay, it's okay. You could be unsure. That's fine. Oh, look at your little emoji. So levothyroxine is actually a medication. I remember giving it all the time in the morning when I used to work night shift at the nursing home. So levothyroxine Synthroid is basically used to treat hypothyroidism. So remember, your thyroid gland is right here. So what did we say the function of the thyroid is? To help with metabolism, right? How fast your body works, right? And remember, I'm gonna help you guys think through this. Remember, the thyroid, if patient has hyperthyroidism, hyper meaning high, too much, too fast. If a patient has hyperthyroidism, okay, guess what? Everything's gonna go fast. Blood pressure is gonna go fast. Temperature is gonna go fast. Pulse, everything is gonna go fast in hyperthyroidism. But Synthroid is used to treat hypothyroidism. So hypothyroidism is when everything is going super duper slow. Okay? So follow me here. So I think Brandy got it. I think Brandy, she sees where I'm going with this. So without even pulling out your drug book and saying, "Oh, Synthroid, I wonder, what's the adverse effects again? Let me write it down." Without doing that, without going crazy into pharmacology, okay? So if we know Synthroid treats hypothyroidism, and hypothyroidism is everything's going slow, what would be an adverse side effect to that? Okay. So you put Brandy's answer up there. Brandy says D. Let's see if that's the answer. It's true. It's tachycardia. Good job. So this is symptoms of thyroid. And remember, adverse effects means things that we do not want to see. Okay, so this is just a quick picture of symptoms of hormone replacement, over medication, thyroid hormone. So you have difficulty sleeping, racing heart, anxiety, nervousness, tremors, difficulty concentrating, feeling overheated, feeling irritable or erratic. Okay, so but the main thing I want you guys to understand is how to remember this without memorizing this. You guys don't have to memorize this. This can easily be a select all that apply question. How can you get this right without memorizing it? Okay. In nursing school, you have a lot of classes, or when you're studying for the NCLEX, there's a ton of stuff to study. Why would you, have to memorize something that you don't have to memorize? Some things in nursing school, yes, you do have to memorize, but certain things you don't have to memorize. Certain things you just have to understand the concept, okay? So in hyperthyroidism and hypothyroidism, if you have too much of Synthroid, it will be tachycardia, okay? Because like I said, hypothyroidism, that's the only way a patient would be prescribed Synthroid, levothyroxine. That's the only way a patient would be prescribed levothyroxine if their thyroid gland is not producing enough T3, T4. So everything is slowing down. But too much of Synthroid, too much of levothyroxine, too much of T3 and T4, you're going to see the same symptoms you would see in a patient who has hyperthyroidism. Everything's going to go too up. They're going to have tachycardia. They're going to have feeling overhead. Like, think anything that's going up. So you'll be too agitated, you'll have tremors, you'll have a racing heart, difficulty sleeping, because everything is going all the way up. Everything is erratic, okay? So I hope you guys get that. That is basically the symptoms of thyroid hormone replacement over medication, okay? All right, next question says, patient Jamie has hypothyroidism, okay? So we all know what the thyroid is. The thyroid is that gland, and we all know what it does, right? Thyroid has to do with metabolism, how well each cell in your body works, okay? The nursing preceptor asked the new nurse, what symptoms should you expect Jamie to exhibit as a result of hypothyroidism? Which of the following would be correct? Okay, now remember we went over already what is hypothyroidism. Okay, so if a patient has let's replace the word hypothyroidism with like a slow metabolism, a very, very, very slow metabolism, because their cells are not working as good as they're supposed to. So would you see puffiness of the face and hands? We actually went over that in the first question. B, increased appetite and weight loss. C, nervousness and tremors. D, increased appetite and weight loss. Oh, I accidentally made both of them the same, but you guys get it. What would you see here? The answer is here. I'll wait for an answer. Don't forget to like the video, hit the subscribe button, and hit the notification bell. Share this video. All right, so remember, signs and symptoms of hypothyroidism. So low metabolism, slow metabolism. So right off the bat, I know it wouldn't be increased appetite and weight loss, not just because it's written twice, but because if somebody has a high metabolism, I don't know if you ever encountered someone with a high metabolism. First of all, they're always naturally slim, so they can eat whatever they want and still rock a bikini, but they're always so hungry and they eat a lot and they still manage to stay slim and thin and trim because their metabolism is high. So what would be hypothyroidism? What would be the opposite of that? Oh, oops. I didn't even see that. Okay. I think Brandy, you put A before I showed it. Okay. Okay. All right. It's going to be a puffiness of the face and hands. All right. So I put here, very good, Brandy. You got it right. It's going to be puffiness of the face and hands. Because like we said before in the previous slide, hyperthyroidism, everything is going up. Hyperthyroidism, the metabolism is going up. So you're going to have these symptoms right here. So it's not going to be increased appetite and weight loss because that's going to be someone with a fast metabolism. They're losing weight. That's what's going to be. It's not going to be nervousness and tremors, okay? So here I put a little picture of disorders of the thyroid gland, hyperthyroidism versus hypothyroidism. So with hypothyroidism, you're going to see dry, like just to put it all in a nutshell, okay? So with hypothyroidism, like your metabolism not working as well, you're going to see dry hair, a puffy face, because remember, the cells are not working, they're working slower. So that kidney filtering all that excess fluid, that's not working as well. So you're going to see more fluid in the interstitial places in the cell. So you're going to see a puffy face. You may see a goiter, a slower heartbeat, weight gain, and constipation. Why are you going to see weight gain and constipation? Everything is working slower. So everything is slower. The digestive system is working slower. It takes longer for food to go through that alimentary canal. So that could cause constipation, could cause everything to be backed up. Basically, hypothyroidism is like being in traffic at 5 o'clock in Houston. And hyperthyroidism is like diarrhea. You're going to see everything speeding up. Diarrhea. That means everything is going too fast in the body. Weight loss, rapid heartbeat. You may see a goiter too. Bulging eyes. Wendy Williams, I believe she has hyperthyroidism. Heat intolerance. They can't take the heat. Hair loss. Okay. All that because their thyroid is going too fast. Okay. So that is a difference between that. So that's why I said, imagine a SATA question. You don't have to memorize, like I said, just think through it. What is a function of the thyroid? The thyroid helps with metabolism. What would be hypo and what would be hyper? What makes sense? So this one makes sense. If it makes sense for you, you never have to memorize a list of things. Well, not never, but most questions you won't have to memorize, okay? Because in the NCLEX, I remember when I was sitting for an NCLEX, sometimes you have a lot of anxiety and you see the select call that apply and all those things. And the NCLEX just wants you to know that you know the basic symptoms, like what everybody else in the nation knows about hyperthyroidism. NCLEX just wants to make sure that you do know the basic symptoms. Like you have to know that they have bulging eyes, rapid heart rate. They want to make sure you know the concept. Okay, so no one's testing to see who's the smartest and who memorizes every little single thing. It's not really a test of memorization. It's a test of understanding the concepts. Okay, if that makes any sense. Okay, next question is, you are caring for a patient with an admitting diagnosis of diabetes insipidus. That's the key, diabetes insipidus. Which medication would you expect for the provider to prescribe. So I'm going to let you answer this question. So the first thing you have to know straight off the bat is what exactly is diabetes insipidus. We're not talking about diabetes mellitus, diabetes type 1, type 2. We're not talking about that. We're talking about diabetes insipidus. It's a different form of diabetes. Hey, the shopping woman, how are you? The shopping woman says D, regular insulin. Okay. Remove. Hey, the shopping woman, thank you. I think, by the way, don't forget to like this video, subscribe, hit the notification bell. I think after this live, I might do a separate live. Okay. D. Jalen says B. Okay, I see more people walking up in the building. Okay. Escape that. Let me love you like a woman. Let me hold you like a baby. Okay. So the shopping woman says D. D. Jalen says B. All right, let's see what it is. Okay, so we've got D and B. Let's see what it is. So remember, with diabetes insipidus, we're not talking about diabetes type 1 or type 2. We're talking about diabetes insipidus. So so we got B, which is Lasix, furosemide. So I already know straight off the bat that 10% dextrose, that's like sugar, furosemide Lasix is actually a diuretic, and a diuretic is something that makes you use the restroom, makes you pee. We have vasopressin, pitressin synthetic, and regular insulin, insulin. Let's see. So the answer is actually vasopressin, pitressin synthetic. Okay. So let's see why it is that. Okay. So basically, we have to this goes back to anatomy and physiology to see what is diabetes insipidus. So diabetes insipidus actually has to do with a malfunctioning of the pituitary gland, and it has to do with anti-diuretic hormone. So we have to understand what is anti-diuretic hormone, aka ADH. So let's break this term down. Anti means against, diuretic means to pee. I'm going to use the most simple terms as possible because that is how I feel like anyone will understand and remember, right? So diuretic means to pee. Hormone, okay, we all know what hormone is, okay? So if something is anti-diuretic hormone, that means anti-pee. That means it's basically, if we didn't have any anti-diuretic hormone, we will be peeing all day. Because you know that we cannot just be peeing all day. Our body has to regulate that, okay? Of course, if you drink more water than usual, you will be peeing more. But essentially, your body has to balance the amount of fluid that is within your body right now and the amount of fluid that you're peeing all the time, okay? So it is not normal for someone to keep going to the bathroom peeing every 2 seconds, unless you're drinking a a ton of water, a ton of fluids, okay, that's normal. But it's not normal for everyone to be literally peeing every 2 seconds. It's not normal. So that's why we have something in our body called anti meaning against, diuretic meaning pee, anti-diuretic hormone, okay? For anatomy and physiology's sake, anti-diuretic hormone is produced in the hypothalamus and secreted by the pituitary gland. Secreted and stored. But for this purpose, just know that it is secreted by the pituitary gland, right? Okay, so I put this picture here so you could understand it a little bit. So it says here, if the pituitary gland produces insufficient means not enough antidiuretic, that means the kidneys will make a lot of urine. That means the patient will lose a lot of fluid, okay? So that is basically what diabetes insipidus is. Diabetes insipidus is the patient has a deficiency, has a low level of ADH hormone secreted in the body. And what ADH hormone basically does is make sure you're not peeing too much. That's it. That's as simple as I can make it. But it's a simple term. ADH, if you don't have enough ADH, you're going to be peeing all day, okay? So a patient with diabetes insipidus, they're not making enough ADH, so they're going to be peeing all day, and that can be extremely problematic. Who can tell me why, if you're peeing all day, why can that be problematic? Because you're losing a lot of fluids. You could faint. Your cells are not working properly because something in their body is not saying, okay, that's enough now. You don't have to pee so much. That is what diabetes insipidus is, okay? So it has nothing to do with glucose and insulin. No. I know you guys see the word diabetes, and some of you may think, okay, let's prescribe regular insulin. We're not going to prescribe regular insulin for this patient because even though it has the word diabetes in it, it has insipidus. So that has to do with peeing. So anytime you see diabetes insipidus, think of peeing and then it'll come to you. Okay? Because we already know with diabetes type 1 and type 2, we already know that even though they're different, and we talked about that last week in our last live, we already know patients with diabetes, they always have polyuria, meaning increased urine, polydipsia, increased thirst, and polyphagia, increased hunger, the 3 Ps. So in diabetes insipidus, you're just going to think P. There's something in their brain that's not telling their body, okay, stop letting out urine, okay? Okay, that's okay. The shopping woman says she misread the question. Okay, that's okay. Yeah. So that's why, sometimes we have to, slow down when we are taking the question, and then we'll understand. Okay. So I hope you guys understand this. So why would we prescribe? So now that we know diabetes insipidus, we already know diabetes insipidus. The body is not telling the body is not telling the patient, okay, you're making too much urine. We already know they're peeing too much, right? So why would we give vasopressin? Okay, so I put this slide so you guys can understand what is vasopressin. Because I always have a lot of questions. I'm like, okay, so why would we prescribe vasopressin? What is it? So what vasopressin is, it regulates or manages the volume of water in the extracellular fluid, okay? So basically, how can I say this? It's fluid space that surrounds the cell, okay? So let's say this is the close amount of thing around me right now that I have to a cell. Let's say, I'm such a girl, right? So let's say this yellow part, my highlighter, let's say this is the cell, and the white part around it is fluid, okay? So the white part around it is the extracellular fluid, and the yellow part is the cell. So vasopressin is a hormone that regulates or manages, that controls the amount of fluid that is outside of the cell. Okay, so in short, the vasopressin interacts with the cells of the kidneys to return water back into circulation, okay? So that's basically what the job of ADH is. So vasopressin sees the cells. So let's say this is, let's say my finger is, let's say this is vasopressin. So vasopressin sees the cell. Oh, hey cell. I see the amount of extracellular fluid. Okay, let me make sure I reabsorb this water back into circulation. So in theory, not in theory, but in essence, what I'm trying to say is that vasopressin makes sure that there is enough water in this area. And how does it do that? It controls how much urine you pee out and how much urine you keep in. And that's basically the fluid around that cell. Okay, so that is basically how it is. This is for my people who are, I just truly believe in understanding why something is that way, so that you always remember, and so that's always in your head, so that if a question is asked a certain way or in a different angle, you know it. So that's basically what it is. Vasopressin interacts with the cell of the kidneys to return water back into the circulation. So vasopressin tells the kidneys, okay, give me back some of that water. Let's put it back into the system. You're peeing out too much. So basically, that's what vasopressin does. Okay, so that's why we're going to give vasopressin. Okay, we're not going to give furosemide Lasix, because Lasix is actually a diuretic, so it's going to make them pee even more. So it's going to exaggerate, or it's going to make the problem even worse. We're not going to give regular insulin, because we're not diabetes. Even though you see the word diabetes, we're not talking about blood sugar here. Diabetes insipidus has to do with the amount of pee. Remember, just think pee. Okay, and 10% dextrose. We're not going to give sugar, because yeah, it's just, it really has nothing to do with sugar, even though we see the word diabetes. Okay, so I hope you guys understand it a bit more. And yeah, so this chart is basically showing you, the hypothalamus ADH is made in the hypothalamus, goes into posterior where it stores and secreted. ADH makes more water absorbed, concentrated urine, less ADH, more diluted urine. So that urine will be very diluted if a patient has diabetes insipidus, because there's less antidiuretic. Okay, so let's see. Next question. You are the nurse working in the med-surg unit. Okay, your patient has been diagnosed with type 1 diabetes mellitus. Your patient has a highly elevated glycosated hemoglobin test, HbA1c, right? In discussing the result with the client, the nurse would be accurate in stating, okay, so the patient has type 1 diabetes and they have a high elevated glycosated hemoglobin test, which is HbA1c, okay? So in discussing the results, what does that mean if a patient has a high A1C? If a diabetic patient has a high A1C, that's basically what the question is asking you. If a diabetic patient has a high HbA1C, elevated glycosated hemoglobin, what does that mean? Does it mean A, it looks like you aren't following the prescribed diabetic diet? Would you say that to the patient? Would you say the test needs to be repeated following a 12-hour fast? Would you say C, your insulin regimen needs to be altered significantly? Or would you say D, it tells us about your sugar control for the last 3 months? So what would you say? Oh, thank you, Dania. Thank you, Dania. That's so sweet. Dania says, hi, just joining in now for the first time. You explain everything very well. Thank you, guys. Thank you. I love that positive reinforcement and reassurance. I know some people are kind of quiet, but I like to know, like, if how I'm explaining, if it helps, or if I'm going too slow. I mean, if I'm going too fast, please let me know. If I'm going too slow, let me know how I can better help you guys understand, because like I'm teaching how I think through questions, and I'm trying to break it down as simple as possible because I know, okay, just because I know it, oh, this person, oh, you should know it, it's easy. No, it's not. I get it. Because I remember, this is a quick story, don't worry, I'm going to go back. I remember like in math, because I always struggled with math, and the teacher would be like, you should know it, you should know it. How you don't know? It's so simple. And other people in my class would say the same thing too. And I'm like, I don't know. And here I am trying to get my RN. I'm supposed to get 100 in every quarter to move on, or else I lose my money, my semester money, and I have to get 100 in math. So I know how it feels like to not understand something. So thank you guys for telling me I'm good at explaining, because that's the whole point. Okay. Oh, thank you. The shopping woman says yes. Great teaching. Great. Awesome. Okay, so Dana says E. The shopping woman says D. Brandy says D. Okay. So you guys choose D. Let's see if it's correct. You guys are so smart. Not because y'all got it right, just because you're so smart for even investing your time. And I'm 100% grateful and humbled. But yes, you guys are right. It's highly edible, the HbA1c test. So you guys are completely right. It tells us about your sugar control for the last 3 months. Okay, so that is 100% correct. This is correct. Okay, so just a quick overflow of anybody who didn't get it right. Why is HbA1c the amount? Why is that the right answer? It's because you have to understand. But quick side note, they're starting to change. They're doing more research. They're starting to develop new tests to see how patients who have diabetes regulate their blood sugar, because they're finding that some people actually have different variations in how long their hemoglobin lasts within their blood. So they're starting to say, we don't know if this test is that accurate, because everybody can have a different time span, so it may not be as accurate. But that's neither here nor there. That's just a quick side note, because I'm always inquisitive. And when I was researching, like when I do these slides, guys, I do research. I do a little bit deeper research so I could explain why something is a certain way, even though I already know. But that's just a quick fact to know. But for now, we use the HbA1c. So red blood cells actually live for approximately 120 days. Okay, so hemoglobin is contained in the red blood cell. Okay, so we all know that hemoglobin is that protein, right, that gives the red blood cell its color, right? So glucose actually enters the bloodstream and attaches to hemoglobin. Okay, and this binding is basically creates the HbA1c. So in a nutshell, glucose combines to the red blood cell, specifically the red blood cells. The red blood cell has protein called hemoglobin, which gives the red blood cell its red color and helps with oxygen and all that good stuff. Glucose here, hey glucose attaches to the red blood cell and forever, essentially. And red blood cells live approximately 120 days. And that's how the doctor is able to see how well is a patient regulating their diabetes. Okay, so that's why we use HbA1c, and that's why it's every 3 months. And actually, one of my patients where I work now, PRN, she gets her blood glucose checked every 3 months, and she goes to the doctor, and they would either change or modify or leave her medication how it is. So it's a great long-term measurement of how the patient is managing their diabetes. But like I said, on the side note, they're starting to change a little bit, but for NCLEX and nursing school purposes, yes, HbA1c, that is basically what it is. Thank you, the shopping woman. Oh, you guys are so sweet. Thank you. Okay. Whoa. Okay. All right, so the next question says, your patient has just undergone unilateral adrenalectomy. Don't forget to hit the like button, guys. Don't forget to hit the like button. Okay, so your patient has just undergone unilateral adrenalectomy. Okay, the doctor would like for you to assess for hyperkalemia. Which of the following symptoms would you see? Okay, so I'm going to help you guys a bit with vocabulary. Okay, hyperkalemia. What is hyperkalemia? Kalemia means potassium because, in fact, actually, let me get a pen. A good way to remember what hyperkalemia means is, you see the K in hyperkalemia? The K is actually, for those of you guys who've taken chemistry, or if you haven't, K is the element chart. K represents potassium. Okay, so as soon as you see the hyperkalemia, you see the K. Remember, K always represents potassium. Okay, so hyper meaning too much. Okay, so what will be the symptoms of too much potassium? Okay, and unilateral adrenalectomy. Unilateral, what does unilateral mean? Right? Uni, one, lateral. Lateral to the side. Uni, one, lateral. Adrenalectomy. Adrenals are the glands on top of your kidneys. You got two. Unilateral. Uni, one, lateral. Ectomy, removal. Okay? Let's see. Shahar says A. Shahar says A. Okay. Okay, so low potassium. So like I said, potassium is one of those elements in our body that is very important. Okay. Dana says, the shopping woman says A. Oh my God, guys, this is so much fun. Okay, the shopping woman says A. Dana says A or C. Okay. Woo! All right. Ruby says C with a question mark. Okay, so I got A and C so far. I got I got 3 A's and I got I got 4 possible A's and 2 possible C's. Okay, so let's see. The answer is A. The answer is A. The answer is A, muscle weakness. Okay, so let's see why it's A. Okay, so first of all, without even looking at the first sentence, which is your patient has just undergone unilateral adrenalectomy, we know that we're assessing for hyperkalemia. Okay, so the question asks you, which of the following symptoms would you see? So they're asking you, what are the symptoms for hyperkalemia? Okay, so assess, meaning you're looking for signs of hyperkalemia. And we already know hyperkalemia. You have to know what hyperkalemia is. We already went over this. When you see hyperkalemia, you're going to see the K in kalemia. And for those guys who've taken chemistry, or even if you haven't, this is the elemental sign for potassium. So anytime you see K, the hyperkalemia, hyperkalemia means the blood, too much potassium in the blood. So the normal potassium level is about 3.5 to 5. And I said, remember, potassium regulates muscle and nerve function, okay? And in hyperkalemia, potassium moves from inside the cell to outside the cell, okay? Because let's use my makeup again. Let's say this is the cell, right? So the glow, the highlight, the Fenty trophy wife, the glow is the cell and the white part is outside the cell. So potassium usually likes to hang out inside the cell, okay? But in hyperkalemia, it goes from inside the cell to outside the cell. And when the patient has a blood test, that blood test is going to pick up on all that potassium outside the cell, okay? So we know that potassium, the function of potassium, it regulates muscle and nerve function, okay? So too much potassium is going to affect muscle and nerve function. So why would it be muscle weakness? Remember, potassium affects muscle and nerve function. So it's going to make the patient have weak muscles, okay? They're going to have urine output little or none because they're going to have renal failure, respiratory failure as well, because remember, the muscles that we use to breathe, we breathe through our muscles contracting and everything, and potassium helps with muscle contraction. So of course they will have respiratory failure. So everything's going down. Decreased cardiac contractility again, because remember, the heart is a muscle. So if there's too much potassium, it won't contract right. That means everything will slow down. So we have decreased cardiac contractility, okay? And the earliest signs here, I have a great chart. The earliest signs here you'll have is muscle twitching, cramps, and on the EKG, you will actually have tall T waves, prolonged PR. Oh no! The shopping woman said, this is hard. No. Okay. This is not hard. Okay, let me break it down. So we all know what hyperkalemia is. We all know it's too much potassium, right? So it moves from inside the cell, because potassium usually is inside the cell, right? And we all know that if it usually hangs out around the cell, hyperkalemia, it starts to seep out and it goes around the white part. So blood test already picks it up, okay? So we know that potassium, right, has to do with muscle and nerve function, okay? So we know so why would it be muscle weakness? Well, if potassium regulates, yeah, it is making us think. Yeah, let's put that up there. It is making you think. Yeah. But the basic premises of it is you have to know what is hyperkalemia, which is high potassium levels, and what would you see with too much potassium in the body. So if potassium affects muscle and nerve function, the reason why I want you guys to understand why, like you could literally just memorize these symptoms and know it, but if you understand why, you won't have to memorize something. And if you have a select all that apply, it will help, right? So if potassium regulates muscle and nerve function, like how your muscles move and nerve function, like what's the purpose of your muscles? Okay, so you would see muscle weakness, okay, because that's just too much calcium. You will see respiratory failure. Like, so everything with the muscles are going down. So why would you see respiratory failure? Because your diaphragm is a muscle that you use to breathe. So if you have muscle weakness, because of too much potassium, it's going to affect all the muscles in your body. So let's name the muscles in our body. We need our muscles to breathe. We need our muscles for our heart to work right. We need our muscles for everything. So we're going to see muscle weakness, yes. We're going to see respiratory failure, yes. And we're going to see a decreased contractility, right? So because of that, we're going to see a weak pulse. We're going to see a low heart rate because the muscle is having a hard time contracting because it's too much potassium, okay? And then in the EKG, we're not going over EKGs right now, but it's good to remember, or good to just briefly overview, and then your mind will pick it up. You will see the tall T waves or the prolonged PR interval. And that's another story for another day. But that's the main thing that you will see, the muscle and nerve function, okay? So that's the main thing that they want you to know. Like you'll see the muscle weakness. Aww. Dania is so sweet. Dania says, if my professors taught like you did, maybe the online classes would have been better. Oh, or any class generally. Thank you. Yeah, that's what I'm trying to do. I'm trying to fill in the gap because I remember, most of my RN schooling, it went from in person to hybrid. I mean, to online to hybrid to in person. And yes, the shopping with someone, it does help to know why. Yes, because if you know why, then the next question you will get, and then when you get a select all that apply, you won't be like, because you know why. Like, I'm not just memorizing stuff. I'm understanding. And the only memorizing part of it, I would say, is knowing the normal levels of hyperkalemia, which is 3.5 to 5, right? Knowing what hyperkalemia actually means, high potassium, and knowing that if there's too much potassium in the body, it's going to cause muscle weakness. But the umbrella of muscle weakness, what falls under that umbrella? A patient's respiration will go low. They'll have difficulty breathing. Why? Because we use, according to anatomy and physiology, we use our diaphragm to breathe. A diaphragm is a muscle. So that's going to go down. Decreased cardiac contractility. Why? Because your heart is a muscle. It's a pump. It's a muscle, right? That means the heart rate will go down. Like, so if you, that's the only thing you have to memorize, like umbrellas. That's a good, like, thing to remember is, especially with SATA questions, select all that apply questions, is you don't necessarily have to memorize. I remember I will give credit where it's due. I remember Mark Klimek, he has great videos on YouTube, like audio. They're not the best of quality, but sometimes we gotta understand the quality, what the essence, the content of what he's saying is so gold, right? And I will always share with you guys my resources that I used. What he said is so important. When it comes to select all that apply, you're memorizing principles. And I like to say it, you're memorizing like umbrellas, okay? So if you know with high potassium in the blood, the muscles are weak, what falls under weakness? Okay, respiratory, use your muscle. Use everything in your muscle, your body. So you will see muscle weakness, right? So yeah, that's the main thing, okay? So we're not going to go into the causes. I just wanted you guys to see this. But another thing you would memorize is tall peak T waves on the EKG and prolonged PR interval. That's another thing you would have to memorize. Early signs of hyperkalemia will be muscle twitches and cramps. Because remember, there's too much potassium. It's too much, okay? Okay. Let's see what Shahar says. Shahar says, for me, I was having difficulties remembering the difference between hyper and hypokalemia. Then I just realized the effects are the exact opposite. The word hyper and hyperkalemia. Oh, that is amazing. You see, that's why study sessions are so good, especially when you have the right people around, right? Not people who talk too much. I'm kidding. Because I'm one of those people where I have to study alone sometimes because I talk way too much. Like when I'm around people, I just want to talk and talk and talk. Like, oh, what kind of lipstick is that? And ooh, I talk way too much. But this is a great example of like how study groups can sometimes be, useful. Shahar says that is so true. Realize the effects are the opposite. Okay, that's a good. Thank you so much, Shahar, for giving that great tip. Excellent tip. It's the opposite. Okay, hyper, you're gonna see decreased muscle weakness. Everything will go down when it comes to the muscles. And hypo, you're gonna see everything go up when it comes to the muscles. Okay, yes, great example. The shopping woman agrees. Excellent example. Thank you. Okay. So now, because I'm an inquisitive person and because I will just want to know, because I'm always like scared, like, what if we have this question? I put this. I said, let's dive. Now we understand why what the hell is that? Okay. Something happened to my computer. Okay, good. So now that we understand why, let's dive in. Like, let's go deeper into the question. I said, let's explore. Why would a patient, all right, let's ask this question. Why would a patient who underwent unilateral adrenalectomy, why would you even have to assess for hyperkalemia? Can anyone guess? Oh, you're welcome, the shopping woman. Oh, you guys are so sweet. You're welcome. Okay. So don't forget to hit the like, okay? And don't forget to subscribe, hit the notification bell so that you never miss a video, okay? So why would the doctor even ask you, okay, your patient has unilateral adrenalectomy. Why would the doctor even ask you, okay, assess for hyperkalemia, okay? We already went over what would you see in a patient who has hyperkalemia. Why would the doctor even ask you, okay, let's assess for hyperkalemia? Okay, Brandy Jones says, because the kidneys are not excreting it. Oh, because the kidneys are not excreting potassium. Okay. Okay, let's see why. Because, I want you guys to start to think like this, because that is how you get answers right, when you understand, All right, let's see. Let's see why. Okay, so let's explore. Why would a patient who has unilateral adrenalectomy get high potassium in the blood, hyperkalemia? Okay, so the adrenal glands, okay, so you see those two kidney like things here. I don't know if the mouse is being picked up here as well. I doubt it, but okay, the shopping woman says because one gland was removed, it could be meds. Okay, let's see why. So you see the kidneys are the two, I said the two kidney shape, of course. Those are the kidneys, okay? The two yellow, weird shaped, I don't know. The two yellow things on top of the kidneys are your adrenal glands, okay? The two yellow things on top of your kidneys are your adrenal glands. And your adrenal glands actually produce aldosterone, okay? So like I said, you have your two kidneys here. On top of the kidneys are those yellow, roundish, weirdish, shapest thing. And those yellow things are your adrenal glands. And your adrenal glands produce aldosterone, okay? So what is the function of aldosterone? Aldosterone increases the retention of sodium and water and increases the excretion of potassium by the kidneys. So Brandy Jones, good job. You got that question right, okay? So basically, that's the job of the adrenal glands. The adrenal glands that sit right on top of your kidneys, their job is to make sure that that you retain sodium and water within your system, right? That you have enough sodium and you have enough water, because we all know we are in need of water and we are in need of sodium. And it's your job, and it's the adrenal's job to increase the excretion of potassium by the kidney. So you see it sits right on top of the kidneys. It tells kidneys like, hey, kidneys. You see it's right on top of the kidneys. It says, hey, kidneys, you better remove that potassium. And the kidneys like, okay. So that's basically how you can remember it, okay? So the adrenal is living upstairs, right? So like I'm on the first floor of my apartment, right? So let's say the adrenal gland is the ceiling. The adrenal gland tells the kidneys, which is this floor, make sure you excrete the potassium. And I excrete the potassium. I remove my trash and I take my trash out, right? So that is basically the job of the adrenal glands, okay? It sits right on top of the kidney. So let's say this is the kidney. This is the adrenal gland. The adrenal gland says, hey, kidney, make sure you remove that potassium. And the kidney's like, okay, I'll remove that potassium. But what happens, but you have two kidneys, right? That means you have two adrenal glands. What happens if you remove one of those adrenal glands, right? The doctor is going to want to check if there's too much potassium, because now you have one of those regulating systems out, right? So now the body, instead of relying on two potassium regulating glands, now we only have one adrenal, and the body's used to having two. So that's why we have to watch out for high potassium levels in the blood, because if one adrenal gland is missing and we have only one adrenal gland left, that adrenal gland is responsible for making sure that the kidney removes all that potassium. And the body, I mean, your patient just got a unilateral adrenalectomy. So now the body only relies on one adrenal gland. So now the body, has to get used to that. So that's why we assess for signs of adrenalectomy, okay? Hey, Aki, how are you? Okay, I see more people in the building. Don't forget to hit the like button, hit the subscribe button, hit the notification bell so that you never miss a video. All right, guys, so let me know if you guys understand why the patient got a unilateral adrenalectomy. So do you see why it's so important to know anatomy and physiology? Huh? I hope you guys can see what, because I know in YouTube videos you guys always see, oh, you have to know anatomy and physiology. You have to know anatomy and physiology. But you always wonder why. So this is the reason why you have to know. Because if a patient has, like they always say, oh, you have to know the normal to know the abnormal. You have to know normal. So this is a perfect example. This is live in action why you have to know that, okay? Okay, Dana says, what would happen in hypokalemia then? Okay, Dana, so in hypokalemia, remember, what's her name? Maybe you didn't see it, but Shahar said, okay, so Dana asked a great question. Dana asked, what would happen in hypokalemia? So the effects are the exact opposite, okay? So if potassium regulates muscle and nerve function, and hyperkalemia causes all the muscle functions to go down, meaning contraction is slow, difficulty breathing, everything is slow because the muscles and nerves are just not working right. In hypokalemia, it would be too much of that, right? So that's what would happen in hypokalemia, because when it comes to hypokalemia, don't get it mixed up with any of the other elements. Let's not put any of the elements yet. We're just focusing on hyperkalemia. When it comes to hyperkalemia, like Shahar says, she says the effects are the exact opposite, right? So if you know one, you'll know the other. And it's like the words are kind of like contradicting itself. Hyperkalemia, too much potassium, muscle function goes down, right? You're gonna get that muscle weakness, respiratory failure, decreased contractility. But hypokalemia, too low potassium, the body's like, oh, what's going on? What's going on? This is not working right. The muscles start, okay? And too much kalemia is like, oh, I can't take it. Too much potassium. Stop it. See how my muscle is moving slow? Stop it. So you're gonna get that muscle, the patient's gonna get that muscle weakness, respiratory failure, because you're like, stop it, too much kalemia, too much potassium. So I hope that answered your question. And let's see. Oh, that's funny. Shahar says, let's see what Shahar says. Shahar says, great example. Every time I look at my ceiling, I remember the purpose of the adrenals. Did you take out the trash today? AKA potassium. I'm so happy you like that. I just my mind, that's another example of how I remember things. My mind just thinks of some wacky stories. Like I listen, guys, I study, so like when I remember stuff, I just think of some wacky things and it helps. Yes, it is important. You're welcome, Dana. I'm so happy you liked it. Thank you. All right, guys, we gotta have a little fun. All right, gotta have fun when studying. All right, next question says, your patient had a subtotal thyroidectomy this morning. Okay, so before I even continue, what is a subtotal thyroidectomy? It means that it's a removal of the thyroid, right? However, they leave a I don't know if I'm pronouncing it right. My accent, first generation American, but they leave a shih tzu, or not shih tzu, that's a dog, right? They leave a something. They leave a little piece of the thyroid, right? So that they make sure the patient has some type of thyroid hormone to help, okay? Because we already established in the beginning of this live that the thyroid is so important because it helps with metabolism and helps our cells function, right? Okay, so boom, right? All right, so during evening rounds, you assess your patient who is experiencing nausea, temperature of 105 degrees Fahrenheit, tachycardia, and extreme restlessness. Oh my God. What is the most likely cause of the signs? Let's see if anyone will know. I'll give you guys a moment to answer. Don't forget to hit the like button. Don't forget to hit subscribe. Hit the notification bell so that you never miss a video. Yes, the shopping woman, subtotal. So if we don't know something, we could always use Google. I love Google. So what is a subtotal thyroidectomy? Subtotal thyroidectomy is a surgical procedure in which a surgeon leaves a small thyroid remnant in, this is what I couldn't pronounce, situ. I don't know, guys. Maybe you guys know how to pronounce it, but I don't know. To preserve thyroid function. So basically removing the whole thyroid, but removing a small amount because, to make sure that you have your thyroid hormones somewhat helping, because you need it to survive. Okay. So yeah, that's what it is. Everybody's saying A, A, A. Are you guys sure? Are you guys sure it's A? Everyone is saying A. Are you guys sure though? Are you guys sure it's A? So Shahar says A. Dana says A. The shopping woman says A. Brandy Jones says A. Let's see if it's A. I don't know. I think it's B. Oh, it's A! You guys got it right. It is A. It is A. Yes, Dana, you got it right. It's A. It is A. It is thyroid crisis. For those guys who weren't there in the beginning, it is thyroid crisis, okay? So we already went over like what is hyperthyroidism. That's basically the symptoms of hyperthyroidism. Too much thyroid hormone. It's 105 degrees Fahrenheit, tachycardia, extreme restlessness. So let's see what happens when a patient gets a subtotal thyroidectomy. And remember, guys, a subtotal thyroidectomy, don't get intimidated by the word subtotal. The only thing that subtotal thyroidectomy means meaning they're retracting the thyroid hormone, but they're leaving a little bit of thyroid piece left because they want that function of the thyroid hormone. They want some type of because you need your thyroid hormone to survive, right? So what is a thyroid crisis? Okay, so I put here that thyroid crisis usually occurs within the first 12 hours after a thyroidectomy. Okay, so you see in the question it says your patient had a subtotal thyroidectomy this morning. So during evening rounds. Okay, so if your patient had a subtotal thyroidectomy this morning, that means you're still assessing the patient, right? So a thyroid crisis usually occurs within the first 12 hours after thyroidectomy, okay? So it causes exaggerated symptoms of hyperthyroidism, meaning high fever, tachycardia, and extreme restlessness, okay? So that's basically what it is. And I would understand if someone thinks like this, because that's how I would think. Like, I would think like, wow, like, so let's say this is a thyroid, right? And let's say this is a thyroid and they take a subtotal thyroidectomy. So they remove the whole thyroid, but they leave a little bit left, maybe even smaller than that. But they leave a little bit left to make sure you have some thyroid function. I would think maybe they have symptoms of hypothyroidism, right? Like low levels of thyroid. But no, they would see high levels of thyroid. So think of it like this. The body is used to seeing, the body's like, I'm used to seeing a whole spray bottle. I'm used to seeing a whole thyroid here. But if the patient has surgery and removes the whole thyroid, now the body's like, oh my God, it's a crisis, right? It's a crisis. So the body's like, oh my God, what happened to the whole thyroid here? What happened? So the body gets so excited, the body gets so panicky that it starts producing from that small little remnant of thyroid. The body starts producing excessive amounts of thyroid hormone because they're like, oh my God, there's not enough thyroid here. What's going on? Remember, our body kind of have, I don't like to say a mind of itself, but our body kind of have a self-regulating system, a mind of itself, if you will, of trying to fix things when your body notices when things change, right? That's why after surgery, people have medications to take and stuff like that after any surgery. I've had surgeries in the past, and sometimes the patient has to have medications and stuff like that because your body notices when something is different. Okay, the body notices that the thyroid was this big, like there was that much amount of thyroid in our body, and all of a sudden you remove this and there's like only a little cap left. What's going on? So the body is panicking and the body's producing thyroid hormone like crazy. And like we said in the beginning of the live, what is the function of thyroid hormone? The thyroid hormone has to do with metabolism. That means if there's too much thyroid hormone, everything will go up. So vital signs all the way up. All of the vital signs will go all the way up, okay? So you're going to see high fever. You're going to see tachycardia and extreme restlessness. It is a crisis. What kind of crisis? A thyroid crisis, okay? So that is why you will see a thyroid. Randy Jones is funny. Jandy Jones is laughing. Yes. Yes. The shopping woman says yes. The body is compensating. Yes. The body is indeed compensating. Yeah. So I have my funny moments. Okay. So we have one last question. Okay. So it is 3:36. One last question. All right. So the one last question is, a male client has hyperglycemia, okay, high levels of sugar in the blood, okay. Which assessment finding best supports a nursing diagnosis of deficient fluid volume, okay? So what would the question is basically asking you, what is symptoms of low fluid volumes, okay? So I'm gonna let you guys have a moment. Oh, that's funny. Thank you. The shopping woman says the water bottle. Help me understand, Kimmy. Yay! It's actually primer water. It's a rose water, like before you put your makeup. Okay. So Dana says B. Shahar says B. Okay. Dana says B and Shahar says B. Okay, I'm gonna let you guys wait a little more. I'm gonna wait a little more for your answers. The shopping woman says C. Brandy says A. The shopping woman says D. Okay, let's see the answer. Our final question. Let's see the answer. The answer is B, increased urine osmolarity. Okay, so Dana got it right, Shahar got it right, Ruby got it right. Let's see why it's right. Okay, the shopping woman says C. Okay, so why is it B? Okay, so a patient has deficient fluid volumes. So deficient fluid volume is a fancy word for your patient is dehydrated. There's not enough water in the system, and decreased serum sodium levels, cool, clammy skin, and distended neck veins are actually fluid volume excess. And you want to know why? It's okay. It's okay, the shopping woman. That's good. That's why we're here, so that we will know next time. So first let's talk about why the other answers aren't right. So the opposite of dehydration is overhydration, right? So why would a person who has overhydration means too much water. So it took me a while to understand why A is a symptom of too much water. Now here's the reason why. It took me a while to understand that. Yes, Dana, you are in the right track. The others would be seeing edema. So decreased serum sodium level, it would be that, like, so let's say I drink like 10 of these within an hour. I will have too much volume. I drink 10 of these water in 1 hour. I have too much water, right? So I would have a decreased serum sodium level because the water is taking up so much space that the amount of sodium molecules are just not enough, right? So basically the water kind of like that, like it's just like, how can I say? It's just like if I put sugar in here. If I put sugar in here, and like if you have a cup of sugar, right? You have a cup of sugar. Let's see, the sugar is salt, and you put a little bit of water, you can still see the salt, right? But if you put like 2 gallons of water, will you be able to see the sugar? You won't see the sugar. Like it will be dispersed throughout, but there will be more water than sugar. So that's why it's decreased serum sodium levels, because too much water, the water is taking up too much space. You can't see the sodium anymore. So that's why it's decreased sodium levels. This will be too much fluid. Distended neck veins is because if there's too much fluid, it's like the vein is like pulsing out because there's like way too much fluid in there. So the patient's neck vein will be distended because it's like the body has to work extra hard to pump the blood because it's like way too much fluid in there. So that's why you see distended neck veins, and then you would see cool and clammy skin. So that would be too much. Okay, so deficient fluid volume would be increased urine osmolarity, because if we go back to biology or chemistry, is it would be thank you, Shahar. You say you have made the world of nursing so understandable. Thanks for using this platform. I love your tutorials. You're welcome. I'm so happy that you find it helpful. That's why I do these. So it would be increased urine osmolarity, because I put this. Urine osmolarity, you have to understand what urine osmolarity is. So urine osmolarity is actually the measurement of dissolved particles in urine, okay? So if a patient has hyperglycemia, which is high blood sugar, remember what we said with patients who have hyperglycemia, which is basically diabetes. A patient who has diabetes, they're urinating a lot because all of that sugar is going in the urine, okay? So if they're urinating a lot because all of that sugar, so the body is trying, remember, our body is always trying to fix ourselves. So if a patient has diabetes, all that, they're losing a lot of water, which is polyuria, because all that water is being removed because the water is actually trying to get rid of all that sugar, all that glucose out of the body through urine, right? So that's going to make the urine have increased osmolarity, because osmolarity is the measurement of dissolved particles in the urine. So that's basically what osmolarity is. It's measuring urine osmolarity. In this case, is measuring how much glucose, how much sugar particles that you see in the water, okay? So basically that's what urine osmolarity is. It's like if you take a water and you putting some sugar in it, osmolarity is measuring how many sugar molecules, like if I was just to dump sugar right now, how many sugar molecules can I see inside the water, right? So that is what urine osmolarity is. And a patient who has hyperglycemia, you will see an increased urine osmolarity. You will see more sugar molecules, because the patient has diabetes, the patient has hypoglycemia, they have way too much sugar. So you're going to see increased urine osmolarity, okay? And I put this reminder here. I said, remember with diabetes, polyuria, okay? So remember I said with diabetes, the urine is leaving the body so fast and there's increased amount of urine, but that urine has an increased urine osmolarity. Because what is urine osmolarity? It's the amount of sugar particles that you can see in the water. And in this case, okay, so it's a lot of sugar that is dissolved in this water because the body is trying to get rid of all of that glucose, because our body regulates itself, okay? And the other options are fluid volume excess, okay? So yeah, so essentially, Dana, yes, the others would be edema. It will be way too much water, okay? So I hope that is understandable. Really? Wow, let's see. If you guys have any questions, please leave it down below. There's no such thing as a stupid question, please. I was told that there's something a stupid question, but in my channel, there is not. Ugh, I hate when people say there's a stupid question. But Dana says, wow, med student here, but I wish every student would find your channel. Oh, your teaching style. What a godsend. You've gained a new subscriber today. Really, Dana? Oh my God. I'm so happy to hear, guys. I love when you guys please hit the like button. Please hit the like button, subscribe, hit the notification bell. Thank you so much, Dania, for subscribing to my channel. I really, really appreciate it. I appreciate it, guys, because when I put these things together, they do take some time. As you guys know, I am working on a course, a very comprehensive full course. That's why it's not out already, because I want to make sure I put out quality content. I am working on a course. I'm going over med surg first, just because I like to slay the big dragons before I slay the small dragons, like maternity, OB, and psych. But I am coming out with a fully comprehensive course. You guys are gonna get. You guys are gonna get questions, answers, rationales, and videos. So I'm so happy. Like, wow, med student. Oh my God. My cousin is actually a doctor. I think she's is it anesthesiologist? She's some ologist. So I'm so happy, and best of luck to you, Dania. You will be successful. Okay. Wow. Brandy Jones says, thank you, Kimmy. I liked and shared. You are awesome and make it think so simple to understand. Thank you. Thank you, the shopping woman. Yes, like this video, guys. It really, really helps. Oh my God. So yeah, that concludes, this study session. I hope you guys really liked it. And I hope those of you guys who are, watching it in the afterthought, I hope you guys are watching it after. Don't forget to leave a comment if you don't understand something, and I will try to break it down even further, because I understand, like, sometimes it's hard to understand it. Like this video. Shahar says, med student, maybe you and Nurse Kimmy could do some practice nurse and doctor reporting or calling scenarios. I'm always up for a collab. Email KimmyDTV@gmail.com. That would be fun, though. And doctor reporter or calling scenarios. I always get nervous with this. Oh, okay. Yeah, with doctors, I mean, if we're talking about real life with doctors, you just have to have all your information. You have to have because they're very busy. You have to have your vital signs. You have to have every information ready. Hey, doctor, that patient has this. This is the vital signs. Boom, boom, boom. They don't want you to waste time. That's one thing. They do not want you to waste time. Like, what is the patient? Hey, patient Jamie has just came back from her appointment. She's having symptoms of shortness of breath. She's not breathing correctly. Doctor's gonna be like, oh, okay, what's the vital signs? And then you're gonna do the vital signs, and now that's basically it. And then they'll tell you. But yeah, thank you. The shopping woman said, this was great, live, Kimmy. Thank you. Well, thank you guys so much for watching. Thank you guys so much for staying tuned. I really, really appreciate it. I'm so happy, like, new people are finding this, and I can't wait to come out with my course so that I can help even more people. Okay, Kimmy, maybe you can tell us on a live how to give a good report to the oncoming nurse. Okay. Let me write that down. That's gonna be a planned live video, because I want to teach you guys the right way. So how to give a good report and if you guys have any other suggestions on videos, what you guys want to see from me in general, please let me know. To the oncoming nurse. And I'm really happy that you guys like my teaching style and like my explanations, because like I said, sometimes a teacher would explain something and my brain is like, what? Like, I'm a type of person where I remember this nurse was telling me, like, that's just because that's how our brains work. Like, if somebody gives me directions, I'm working on this, but if someone was giving me directions, like, to go somewhere, like, oh, you want to go to, let's say, Chick-fil-A, all you have to do is make a left here, make a right, and then you go down 3, and then make a left, and then make a right. And most people be like, oh, okay. And I'm always like, what? Like, that's just how my brain is. I have to break it down and say, wait, do I go 50 miles or do I go 20 miles? Do I go up to the red post? Like, I'm like, that's how my brain works. And I felt like for the longest time, I felt like nobody understood that. I'm like, oh my God. So that's why I always, in my questions, when I do these lives with you, I always break down why it is, because that's just how my mind works. But sometimes in real life, let's be honest, if you ask that question, people look at you like you're stupid. They're like, why don't you get it? And that's why I'm trying to reach out to find people who have my brain, like who think like me and who understands, and like just take them and be like, it's okay, you're normal. Everybody's brain is completely different, you know? Dana says, I was looking for a study with me and ended up here. Really? Oh my God. And I'm not regretting. Learned so much, and a bit of it was kind of like a revision. That's excellent. Oh my God. Well, yeah, that's why I'm trying to make these before, like, I graduated in November, and I'm trying to make these before the knowledge removes my gets removed from my brain. Shahar said, what a great suggestion, shopping woman. Okay, I'm definitely gonna make it. How to give a good report to the oncoming nurse. Yes, I'm definitely gonna make that. A good report to the oncoming nurse. Okay. So, but are you guys liking the every Sundays at 2? Right now, my Sundays are open. So, but I think Sundays at 2 is pretty good. Yeah, it gives me time to work on stuff. So I'm gonna try to make that live. How to give a good report. I'm gonna plan for it. I'm gonna try to make that live within this week. Definitely within the next 2 weeks. But yeah, I'm definitely gonna do it. I'm just gonna do a little research. Okay, yes. Shopping Women said yes. Sunday at 2 is fine. Yes. And just in case none of you guys were here, I know it was kind of like quiet last week because of Mother's Day. So just want to say happy belated Mother's Day to all the mothers out there. And yeah. Really? Oh, Brandy Jones said, remember, 2 p.m. Central Standard Time. Brandy Jones says, yes, it works for me. I was so looking forward to 2 p.m. Aw, you guys are so sweet. Wow. Dania says, thank you. It's almost 1 a.m. in here. Wow. Where are you from, Dania? 1 a.m. Where are you from? But since it's exam season, it's normal to be up at such a time. Yes, it is. Wow. That's amazing. Don't forget to hit the like button, guys. Hit the like button. Yeah, 1 a.m. Where are you from? Let me turn on my studio lights. My studio lights are basically my vanity. Dania, where are you that it's 1 a.m.? Okay, I'm from Sudan, but I live in the UAE. People know it as Dubai. You live in Dubai? Oh my God. I want to go to Dubai. That's my next travel. I either want to go to me and my friend were talking about it. I either want to go to Egypt next or Dubai. I wanted to go this summer for my birthday because my birthday is in August, but they say Egypt is very hot in August. But that's so cool. That is so cool. Dubai. Hey. Dubai in the house. Yay. Shahar says, yes, this is my first I with you, but I plan to come back. Thank you. Thank you, guys. Oh, okay. Dania says, the country is the UAE, but Dubai is just a city in it. Oh, okay, my man. Yeah, I got to work on you see, I love to travel, but I got to work on my geography. I'd be like, where is that again? But that's awesome. That is awesome. I love traveling, guys. I really hope that this whole, I don't even want to say it because I don't want my video to have any restrictions. But I really hope this thing stops, because I really am ready to travel. I'm ready to go out because I love traveling and just being free, you know? There's so many restrictions now, but that's so cool. Dubai, UAE. Yeah. I met a lot of doctors when I used to work at the clinic, and you guys are so cool. So dedicated. Yeah. Wow. But yeah, I'm just, to be honest with you, I'm very, very humbled, and I'm very, very, like, I didn't, you know, I didn't expect a medical student to, find it helpful too. I'm like, what? 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 That's amazing. That means all my hours of studying weren't for nothing. It's pretty good. But yeah, guys, just to encourage you to keep studying, keep going, keep striving, because you always reach your goals if you just stay focused. And it's not always easy, to be honest with you. Like, even with me, like, if you guys saw my video transitioning from LPN to RN, like, I do have, like, even though I'm a good encourager, I do have my down moments. I do have my moments when I feel like, what the hell, like, what's my career going? And I do have my moments where sometimes it's hard to stay on track to attain your goals, because you may look around you and you may see that, your life is not going exactly where you want it to be. And that can be extremely, extremely depressing. I'm not going to sit up here and, pretend I'm not going to pretend like I'm always super motivated. No, there's sometimes when I don't feel motivated. There's sometimes when I feel like giving up. There's sometimes when I feel like what's going on? There's sometimes I feel defeated, beat up. That does happen to me, but I do have those feelings, but I always just remind myself to push on, and I try to surround myself with positive people, I try to surround myself with positive people, only keep positive. I try to only keep positive people in my surroundings, joining different organizations, and, just collabing. That's why I love the internet and I love YouTube, because I genuinely enjoy making videos for you guys. I've been making videos for years now. I genuinely do love connecting with you guys, sharing my experiences. I love it because it's like I have my own online friends, that understand the path. Even if you're not in nursing school, even if you're in medical school, it doesn't matter. We all have that same thing of being a student, of learning our career, everything. The shopping woman says, do you have a balance of work and fun? Yeah, I think I do. I think I do, but now that I have this new goal of creating the course, I think that I have to put down a lot of fun. I have to put down more fun a little bit and go back. But yeah, I try to have a balance of work and fun. My main thing is I'm just trying to find my footing within nursing, because I think that should be another video I make too, is basically when you become a nurse, sometimes people think that, your life is going to be perfect, but that's so far from the truth. It takes some time to find your dream job. Sometimes it takes some time to find stuff, so it's not always easy, so still in the transitioning phase, and I'm still in the phase of trying to find something that actually makes me happy, and just to work in a good, healthy environment, a decent positive one. And I'm just still like trying to find that out. But right now my passion is helping you guys and developing that, and like just helping you guys attain your goals. I feel like that's my main passion right now. Nursing and geography all in one. Yes, learning new things every day. Yes. The shopping woman says, "Don't burn yourself out, Kimmy." Yes, I don't think I'm. Yeah, I should work on not burning myself out. Yeah, I probably should. You know, I have a hard time realizing when I'm doing too much. Like, okay, Kimberly, you're going too much. But at the same time, I feel like now is the perfect time to go after, you know, my goals and just to complete them, because everything is closed down. Well, actually, in Texas, here in Texas, I heard like Texas was never even closed down. A lot of things are open right now. There's a lot of fun things to do. Not a lot, but you know, I mainly want to travel. But now that there are certain restrictions, and you know, I just moved, you know, like look at my bed. Look at my bed right now, guys. See, this is proof. I love to travel. My bed says freaking Paris. Like, last time I was in Paris, it was in 2019. I'm itching to go. I really want to go. Yes, the shopping woman. The shopping woman said, maybe create your own career path, work for yourself. That's what I'm trying to do. Yes, that is what I'm trying to do. It's not always easy though, because you know, initially when you do that, you have to either commit not a huge, but a big chunk of money or time. So right now, that's what I'm trying to do, is like make quality content for you guys, and maybe, oh my God, and maybe, not maybe, I have to claim it. And through that, you guys are gonna go back and watch this video. Not you guys, but I'll take this clip when I make it and be like, yeah, I wanted to create my own career path, and here I've done it. And yes, it will be done. I declare and declare it will be done. Okay, because I feel like everybody in this earth is put on earth for a certain reason. Everybody is put on here for a certain purpose. And I feel like one of my purpose is to, you know, support you and lead the way and teach, because a lot of things I had to figure out the hard way. I had to feel in the dark before I find it. Texas never closed like Georgia. Yes. But I was in New York. For those guys who don't know, I lived in New York and I came here in January. So I've been here for 4.5 months. Oh, Kimmy, how can we support you for more of your time and energy? Okay, so there's a super chat. When you guys come in, you guys could always contribute with a super chat for now, until I make my course. And if you guys want to support me even further, you know, that the course will be there for those, you know, who want to partake in it. But yeah, but for now, yeah, that's how you can support me. Super chat. Yeah, there's a super chat here. I guess I should start adding my Cash App. Maybe I might start adding my Cash App in the description. But yeah. But thank you guys. I thank you so much for asking that. But yeah, I just want to make sure. I always want to make sure that I will definitely charge a fee for your courses. Yes, of course. Because let me tell you guys, to make these courses, it takes a lot. Because I want to make sure that, like, because when I started nursing school, I took other courses, like NCLEX courses, but I never saw a course that was just specifically for nursing school. And it would help with NCLEX too, but it's mainly for nursing school. I want to make sure that you guys have all the questions and answers. You have the videos, like, just basically everything I feel like you will need to succeed. So if I could pass that on, I'll be happy. But yeah, I will. And yeah, but my main goal right now, she said, pay for your time. Thank you. Yes. Because with if the more I'm successful, at YouTube, at the courses, the more I could make more. Because like if I wasn't working at all, I would probably have the course ready in a week because I would be on it. You see what I mean? Oh my God. Brandy says $10. Give me $10. Thank you. She said, thank you. I appreciate you. And we'll be back next Sunday. Thank you, Brandy. Oh, that's so sweet. Thank you. Oh my God. Thank you. Thank you. Thank you so much. I appreciate it. You guys actually made my day just by being here and giving me all this positive reinforcement, because this week I was kind of like a little down the dumps, just certain things. We're not going to get in deep in that. But I was feeling kind of sad. I don't know if it's because it was raining. It's supposed to be raining a lot over the past few days. But just seeing that, it makes me so happy. Thank you, guys. Thank you. Yeah. Yeah, so check up on your friends. The friends that always look happy and like positive all the time. I guess that's the best advice I would always say. Like always check up on the strong ones, because sometimes like what you see is not, someone may look happy, but they may be going through stuff. We're all going through stuff with the pandemic and stuff, but I'm trying to just make it out here on my own in Houston, Texas. Dania says, I'm all here for your energy. I get so much positive energy from you. Thank you. Thank you. And, that's why, like, as positive people, we also have to, and I believe you guys are positive. You guys that are watching right now are positive, because like attracts like. We also have to protect our energy too, right? We also have to protect our energy too. I even talked about like sometimes, not everywhere, but sometimes when you work in a certain like environment, if people see that you're positive, they get upset, and then they try to make your day go bad, which is really sad. But yeah, that's why I love coming on here, because it's always positive. I always have a smile on my face when I'm here, so it just encourages me to continue doing what I'm doing. But thank you guys. You guys gave me such a big encouragement. So now I got to make sure my next live is even better. Okay. So if you guys have a specific system that you would want me to go over, even if it's the same system, whatever, let me know and I will go over that. But we'll be going over, as the weeks go on, we'll be going over different systems. But thank you guys so much for all your support. Oh my God. It lets me know it's not for nothing, Yeah. So yeah, guys. I hope you guys enjoy the rest of your week. I hope you guys enjoy the rest of your week. This is like such a side comment, but if you guys like my makeup, I bought the Naked Urban Decay Heat. This video is not sponsored, and I love it. I was watching Lori Harvey's makeup from the Vogue video, and I love it. That's what I have in my eyes now. Aww. Shahar gave me $5. Thank you, Shahar. Thank you. I'm gonna come back even better next week with my live video. Thank you. Thank you guys. You guys are so sweet. Thank you. You guys are really pushing me to work harder on this course, work harder on my future lives. It's gonna be popping, okay? Popping. It's popping. Thank you. Thank you so much, Shar. Thank you, everybody who came out to study. Thank you to everybody who's going to be watching this video in the future as this video goes out. And last but not least, I hope that you guys have a blessed week. your protected week. And I hope you guys have a productive week. And I will see you guys next Sunday at 2 p.m. for another study session. And I will work on, actually, please put Cash App in your description box. Okay, I will. I don't even, what is my Cash App? That's a shame. Let me see. What is my Cash App? Okay, I will put in this description box. But I think it is. Oh, okay. So from my Cash App, you guys are probably going to guess how old I am, because I never like to say how old I am. So immature. No, I'm just kidding. Okay, so I'll put it here, but I'll put it here. Thank you, the shopping woman. So I will put it in the description box. So after this becomes live, I will also put it in the description box. Let me see. $. KIMO. So yeah, y'all better not guess my age with my Cash App. Y'all better not guess my age. Everybody always asks, how old are you? How old are you? I'm like, it doesn't matter. But yeah, so I just put my Cash App here, and after this video ends, I will put it in the description box. But yeah. Oh, thank you. Oh, the shopping woman says, you like my makeup palettes? Oh, thank you. Yeah, Urban Decay Naked Heat is very good. And for my blush, it's turning into a makeup tutorial. For my blush, this is by Juvia's palette, the Shaharan blush. And I actually use this, and I do this. Because I showed Lori Harvey do that, and I did this. For my bronzer, I first used the cream contour from Black Radiance. I use this and this, Black Radiance, and then I go over it with the powder, this and this. And then, oh yeah, and when you put in the bronzer, I just pat it in. I don't sweep. I used to, but they say you're supposed to give that, because my mom has really high cheekbones. It's so nice. I'm like, Mom, why didn't you give me it? Oh, thank you. Dana said you don't look a day over 21. Thank you. I try to do my skincare routine. Oh, thank you. Granny says, girl, stop. You're beautiful. I'm 41. Okay. I'm all about embracing your age, however old you are, because if you don't get older, you die, right? So, and just embracing every age that you get to and learning new things. Like, one thing I like about getting older is that I see things in a different way, and I grow exponentially, and my tolerance, my resistance grows. Like, if I find something out, like for example, recently, I'm not going to get into detail because it involves other people who probably would not want their business broadcasted. Like, I decided to be a YouTuber. My family didn't. My family didn't decide to become a YouTube. My friends didn't, so I'm not going to give that. But I found out certain news about people about that was thank you, Miss Shopping. Oh my God. Miss Sophia, thank you. That scared me. I was like, what is that? That's actually the Cash App. Thank you, Miss Sophia. Oh my God. Mwah, mwah, mwah. Oh my God. Oh my God. I feel like I'm about to cry right now. Oh my God. Thank you so much, guys. And it's not just like about the money. It's just like about the support, Thank you guys so much. I really appreciate it. Thank you. Because I was feeling so down. To be honest with you, I was feeling so down. Like, I was just feeling like a little sad, but the fact that you guys are supporting me, like, thank you so much. You guys are so sweet. But yeah, thank you guys. Yes, thank you, the shopping woman. Thank you. Mwah, thank you. You just totally made my day. Thank you. And it's not about the money, it's just about the support, and thank you guys. Thank you. Oh my God, if only you guys knew. Oh my God, if only you guys knew. Yeah, but as I was saying, a loved one of mine is going through something right now. And before, in the past, I would just like totally fall apart, because I hate seeing people in my life that I love suffer. Like, I really hate it. I guess that's why I'm a nurse, right? But I'm not giving too much detail, so I feel like I'm handling it better now. I'm not saying I'm 100%, but my heart is just so freaking, and that's not always a good thing, right? My heart is just so, like, when I love someone, like, my heart is just so freaking sensitive when it comes to my loved ones. Like, I hate seeing them suffer, let's guess. No. No. Thank you so much, Sophia. Thank you. Oh my God. Mwah. But yeah, so like been dealing with that and stuff like that, and being away, like moving and stuff like that. It is stressful. Sometimes it could be stressful, sometimes I love it. But here's one thing I've learned from like being on my own and moving to Houston is freedom is not free. Let me say that again for the people in the back. Freedom is not free at all, okay? Freedom is not free. It is, freedom costs, okay? But through that, you learn life lessons, and you learn different stuff, and yeah. The shopping woman says, love makeup. I think more nurses need to wear it. Yes, it's about looking good at work. That's another video. That's so true. Let me take a picture of that comment. Let me take a picture of that comment. That is so true. So I don't have to write it down. That is so true. Guys, I do believe in, that's another reason why I like the South. I'm not saying you can't be feminine in the East Coast, but in the South here, you get praised for being feminine. And feminine, not to go into deep, femininity is not just about putting on makeup and looking pretty. It's so much deeper than that. But I do like looking good. I do like coming to work for looking good, looking nice, and it just makes me feel better. Like, sometimes I could be so sad and depressed and crying, and if I put makeup on and I have my outfit together, and when I go out, people are always asking me, where are you going? Where are you going? I'm not going anywhere. I'm just doing this to make myself feel good. It makes me happy so that I don't go out and spend. Because I used to do that. I used to be like an emotional spender, but I stopped that completely, especially moving out on my own. I stopped that completely. But just getting up, putting my makeup on, it makes me feel so happy. Like, I can't explain it. It just makes me feel happy. It makes me feel better. Shahar says, this past year, you've been an inspiration. On many, many days. Whenever state is expecting, I review your videos. Also as a refresher to keep me on my toes. Yeah! Thank you for your positive energy and videos. Well, thank you so much. Oh my God. Thank you guys so much. This inspires me to make more videos. I think I'm gonna pre-record a video. There's a video I wanted to come out with. It's basically about an app that I found that you could basically kind of like be your own boss, but I'm gonna come out with that too. I'm so happy, guys. Like, yeah, I did make a lot of investments in my channel, and I'm like, seeing these comments make me want to work even harder and harder. I did, like, what I'm recording right now is a MacBook. So I did buy a rose gold. I bought a rose gold MacBook Air because my other editing system was actually back in New York, but now I don't have that computer, so I bought that. So that's one investment I made towards this channel, is my MacBook Air, and I got my camera and everything. Shahar says, I agree, shopping woman. I'm always trying to be a better version of myself. Yes, guys, and it's always about like trying to be a better version of yourself and just trying to grow, you know? But yeah, I'm so happy that you guys like it and enjoy it, you know? So, you know, I always think to myself, like, and like even before, like, to be completely honest, I used to think, I don't know if anybody like really appreciates my channel, because I know comparison is the biggest thief of joy. You shouldn't do that. But sometimes when I see like, you know, other YouTubers, like, oh my God, they already have this amount of subscribers and this amount of views. And I see myself, I'm like, well, I've been on YouTube for this long. How come I'm not there? And this and that. And I think there are some changes definitely I can make or make things better. But then I think to myself, you know what, Kimberly, like, take it easy. Like, you've been through, not everybody has the same path. You've been through X, Y, and Z. You've been through X, Y, and Z in life. You've had a lot of dramatic changes, and just take it one step at a time. And most importantly, be grateful for where you are now. Okay, be great. Even if I have been on years, it doesn't matter. I'm grateful for where I am now, and I'm grateful for my new subscribers. And I'm grateful for the people who watch, even if it's one person. I'm grateful for it. Yes, I want to progress. I'm not gonna lie. I'm a human being, sort of kind of a perfectionist, trying to heal from that, because being a perfectionist sucks. But yeah. Shahar says, however, I have thought, what would happen to the sterile field if a lash fell off? Oh, guys, I used to get my lashes professionally done. I have mascara now. Right now I have on, let's see if I have Too Faced Better Than Sex mascara. It's my favorite mascara. I haven't found one that I like that is better than that. But right now I have the Too Faced Better Than Sex mascara. Let's see. This is it. I got my lashes, like the individual lashes, but they're kind of pricey and I wanted to save money. So I'm like, all right, let me save some money for now. I will get it back soon, but let me save some money for now. So my account is on freeze right now. So I go to Amazing Lash Studio. Yeah. So, and I take breaks from it because I heard it could rip off your lashes. That's why I don't get the heavy lashes. I get the style Gorgeous and like a long length, but it's not too heavy. Dana says, came here and got motivation, positivity, and knowledge. Kudos to you. Thank you. Thank you. That makes me tingly. Thank you. Shahar says, so for now, I save the lashes for the off days. Okay, yeah, a mascara. Hey, there's nothing wrong with a good mascara. That's what I basically wear to work, you know? Mascara. But when I do my doubles, like yesterday I did a double. I worked from 6 a.m. to 10 p.m. Well, actually, I went home at like 11:20 because I had some work to do afterwards, like some documentation. So I worked from like 6 to 11:20, and the nurse had to actually walk me out. She's like, let me walk you out of your car so that you're safe. And I was like, thank you, I appreciate it, because, you know, you got to be safe, okay? A young lady out at 11 something p.m. at night, you want to be safe. So when I have my doubles, I'm not gonna lie, when I do have my doubles, I don't wear makeup unless I really, really want to, but because I know I'm gonna look all over the place, like, yeah. So yeah, guys. Yeah. I don't know if you guys want to know about my administering COVID vaccine shots. That might be a separate pre-recorded video, but I also gave COVID vaccines as RN, and that was very lucrative. That was a good way to save my money. So I think I may make a video on that. Oh, looking good. Yeah. Yeah, guys. So that's what I'm focusing on now. And I actually went on orientation for another job, and this nurse was like pushing me to get my BSN. And I'm like, why? I'm eventually going to get it, but Brandy Jones says, have awesome Sunday, family. See y'all next Sunday. Yeah, y'all my new family. Yay. Thank you, Brandy. Thank you so much. Yes. So I hope you guys have an awesome Sunday. Let me log off of here so I can work on this course for you guys. I'm going to get something to eat first because I'm starving. Let me log off of here so I can work on this course for you guys. Work on some. I'm actually going to pre-record a video right now to put out later this week. Let me do these things so I can pre-record, plan out and everything. Thank you guys so much for, dang, we've been on here for 2 hours and 20 minutes. Thank you guys so much for staying tuned. I hope you guys have a beautiful Sunday. I love you guys. I love you all. Leave comments down below. Like the video, subscribe, hit the notification bell, and I'll see you later. Bye.